Safeguarding awareness for children and young people. What is safeguarding? Safeguarding children and young adults means protecting a person's right to live in safety, free from abuse and neglect. It is about people working together to prevent and stop both the risks and experience of abuse or neglect. Safeguarding and promoting the welfare of children is defined as providing help and support to meet the needs of children as soon as problems emerge. Protecting children from maltreatment, whether that is within or outside the home, including online. Ensuring that children grow up in circumstances consistent with the provision of safe and effective care. Preventing impairment of children's mental and physical health or development. Promoting the upbringing of children with their birth parents, or otherwise their family network through a kinship care arrangement, where this is in the best interests of the children. Taking action to enable all children to have the best outcomes in line with the outcomes set out in the Children's Social Care National Framework. What is child abuse? Child abuse refers to any child under the age of 18 years, who through the actions of a parent or carer, or their failure to act, has suffered or is likely to suffer physical or serious emotional harm. Principles of Children Act 1989 and working together to safeguard children. 1. Children's welfare is paramount. 2. Children brought up with own family where possible. 3. Partnership. 4. Children's wishes and feelings taken into consideration. Forms of abuse in children and young people. Physical abuse. This includes shaking, hitting, drowning, poisoning, burning. This may also be caused when a parent or carer feigns the symptoms of, or deliberately causes ill health to a child. Emotional abuse. Persistent emotional ill treatment causing adverse effects on emotional development. Making a child feel that they are worthless, unloved, and inadequate. Age or developmentally inappropriate expectations being imposed on a child. Causing children to feel frequently frightened or in danger, or the exploitation or corruption of children. Neglect. Failing to protect a child from physical harm. Failure to access appropriate medical care or treatment. Failure to provide adequate food, shelter, and clothing. Persistent failure to meet a child's basic physical and or psychological needs. Sexual abuse. Physical contact, penetrative or non-penetrative acts. Non-contact activities, pornographic material or encouraging a child to act in an inappropriate sexual manner. Forcing or enticing a child to take part in sexual activities, whether the child is aware or not. Indicators of abuse and neglect. Behavioral indicators. Changes in behavior with no apparent reason. Fear or wariness. Relationship difficulties. Depression, anxiety, or emotional upset. Regression or deterioration in development or progress. Describing abusive events. Self-harming. Acting out. Physical indicators. Bedwetting. Burns and scalds. Bites. Broken bones. Mouth or other facial injuries. Poor physical condition. Self-harm. Bruising, cuts, welts, burns, hair loss. Information sharing and confidentiality. Sharing the right information, at the right time with the right people, is fundamental to good safeguarding practice. As a general principle, it is your responsibility to raise a safeguarding issue or concern with your practitioner or another member of Volunteer Centre Sutton staff. If you are not sure if your concern is covered by this policy, share it anyway and we will be able to help. The law does not prevent the sharing of sensitive, personal information within organizations if there is a safeguarding concern. Managing a disclosure. Listen carefully to what is being said, do not ask lots of questions or interrogate, allow them to tell you in their own words. Be reassuring. But do not give your opinion. Confidentiality. You should remind them that you must share the information. Do not make promises. You cannot predict the outcome. Confirm that the information will be treated seriously. Make notes, verbatim, facts only. Sign and date it, then pass it to your practitioner as soon as possible. Volunteer Centre Sutton will manage disclosures in line with London Borough of Sutton safeguarding procedures. Sharing a concern. Early referral gives more time to protect the individual and can prevent the situation from escalating. If unable to contact Volunteer Centre Sutton and there is immediate risk, call 999 or duty social worker. Then follow this up with Volunteer Centre Sutton. Your practitioner will advise you of the next steps. Our designated safeguarding officer is Anita Morlin, CEO of Volunteer Centre Sutton. If you have a concern about the Volunteer Centre Sutton or any member of our staff or volunteers, you should contact LBS directly, Local Authority Designated Officer. Further information on safeguarding procedures can be found using the links below. Thanks for watching.